always love these events because I get to see people like you in person. It's always fun to hang out with you.
Likewise.
Had some time today to catch up on a number of other things, but glad you're here talking to us about.
I'm happy to be here.
Seeing. So, HMPS, one of the couple of conferences you go to a year.
Yep.
What's your impression? What are you learning? What are you hearing? What are you seeing?
I feel like this is maybe the first chance to be in a community of smart healthcare marketers after it's fully kicked in what's going on with large language models and how much they're changing things. And so it's like a different event in some ways than the last 10 years of these conferences, because people are really quite far along in thinking about what's happening and how things are changing, and the conversations all just seem kind of different as a result of that.
You went right to the tech.
Yeah.
That's awesome. That's what I like about you. But
generative AI, large language models, and the change, you can't ignore it.
Maybe share why you're talking about that. Tell them a little bit about who you are, what you do.
Sure, absolutely. So I run the health vertical in a company called Valtech, which is an international digital transformation and digital innovation company. It is about 6,000 people worldwide, and I run a team of about 100 people in the U.S. that are focused on consumer healthcare, working with Hopkins, Penn, UCSF, UCLA Health, many other clients.
Right. And other verticals within the healthcare industry too, which is interesting.
As well as pharma, medical devices, and other things. Yep.
So you're also a prolific writer. You write about a lot of things, and one of the things you've been writing a lot about is AI, the impact it's going to have in our industry. And that's kind of one of the resonant themes that we're seeing here at the conference, right? There's someone joked, right? There's like 70 sessions that have AI included in it. Yeah,
I'm sort of glad I didn't speak, because I think I would have just been one more person talking about this subject, from yet a different angle.
But it's a different type of conversation, right?
Yeah.
We're the people here that are they're healthcare leaders, they're marketers. They're not necessarily the tech people here.
Yeah, and the tech people, the tech people within the consumer healthcare world are probably not at a substantial advantage on this subject, because machine learning and large language models and the kinds of things that OpenAI and Google Gemini and others are doing really don't have very much to do with what IT departments have been doing technologically for a long time. Mm-hmm. So everybody is kind of coming in on the ground floor, and a lot of the technology is really being handled by the vendors. What I think is the space of play is people trying to figure out how they're going to use it, if they're going to use it, because of the ethical and security and other kinds of concerns which run deep. And then also, sort of how human beings fit into using it, and how roles and things might have to change or tweak a little bit in order to actually meet the day, so to speak.
Human-machine dyad.
Yes, exactly.
Technical, right?
Exactly.
Because it's going to impact us in a profound way.
Yeah.
That's what I believe, and I was one of the 70 people that talked about this, but it's different than how people are kind of conceiving it today. And the interesting thing about it too is when we get to the crystal ball part of our conversation, it could go places we're not really even sure it's going to go.
Yeah, and it has a momentum behind it. One of the things that I'm fascinated by is I think human beings have a lot of conflicting, kind of imperatives. They have a lot of conflicting drives, a lot of conflicting things that they want. They want adventure, they want to be safe. We're full of contradictions as human beings. One thing that human beings seem to really like is new capabilities. Mm-hmm. And I even see this in myself, because things that are dangerous in the world of AI, you can think about the danger, but there's still a part of you that's I want to see the miracles. I want to see it actually happen. And I think on a much less dramatic scale, that's in play everywhere, in the sense that people want to integrate this stuff and in a smart way, and which is what they should do. But at the same time, they are being pulled forward to some extent by the capabilities. And once you see a new capability and that it really works, it's hard to ignore it. And that is driving, I think, a lot of change.
Right, and that's driving kind of the conversation, the adoption, why this is a hot topic at conferences, right?
Yeah.
And healthcare leaders are facing so many unprecedented, I hate that word, challenges, right, that's impacting the industry. So I think that's why it's naturally here, because we're looking at it as potential lifelines to solving some of these problems, right?
Absolutely. I mean, it has this kind of, this kind of unusual kind of double reality to it. On the one hand, there's a ton of problems to solve in healthcare. I mean, hospital systems have a huge amount of difficult things that they're dealing with, really starting, I would say, maybe in 2019 on. And then at the same time, it's also a competitive consideration, because if it can produce a much better experience or much better outcomes, or even just loyalty, the things it can potentially do for loyalty with patients, there's a real danger in not paying attention to it. And yet, it is such a new field and it is moving so quickly, it's very hard for people to get their arms around it. And I think the conference has been really good. I mean, I have always had a lot of respect for this conference. I think it has been really good at delivering a lot of content for people to chew on. And even if people don't come out of it with a strategic plan for AI or for generative AI, they are certainly coming out of it extremely educated, which is great and makes the whole conversation more possible going forward.
Well, marketers, communicators, they have to be able to communicate about this because, CEOs are hearing about this. Clinicians are hearing about this. And you're right, like the IT departments have already been operationalizing a lot of this, and we're not part of those conversations per se, yet we're being often turned to say, hey, you need to promote this capability and awesomeness of it. I think having that education and having forums like this to give that education is critical for leaders to stay relevant.
Yeah, it is. And it's, one of the things about healthcare in the U.S. is it has a very slow changing kind of organizational structure. And I think when you have something that is as big a phenomenon as this, and it is sort of touching almost potentially every part of the organization in different ways, it is really hard for people to figure out how to work that in a slow-moving, slow-changing kind of environment of silos and so forth and so on. So it raises a ton of questions for institutions, for absolutely.
Right, and I've been part of some sessions that kind of highlighted how they're approaching it.
Yeah.
And what's interesting about it is everybody approaches it differently.
Yeah.
But I think people love seeing and hearing other people how they're kind of managing and adopting these tools. It's hard to say which one's right or wrong. In fact, we had a question in one of our sessions, John, that was like, how are you seeing value from these tools? And many of these strategies that they're implementing now, they're like 3 months old, right?
Yeah.
And in health systems, that's like you don't measure things that quickly.
Well, I think it's also, I think one thing that has really occurred to me, through the last 8 to 10 months where this has been really emerging as such a huge, powerful thing that's going on in the world, is that we really don't have the institutionalized methodologies for adopting so much change so quickly and doing it in a safe way. Yeah. So for instance, like an example would be that, if you have AI co-pilots that are helping in telemedicine to understand what patients are saying, to take notes, to abstract from the notes, and to ultimately get an approval from the physician.
What's interesting about that, right, is that this is a technology issue.
Yeah.
Yeah, it's clearly, right? AI is a technology thing. But other sessions that I've been hearing at this conference is like, how do CMOs adopt to something like better relationships with the CFO, or how do they adopt to improving their value? And all of them kind of trench down into the same things. It's like, these are new things that we have to deal with. New ways to solve for them, and the way we do it is by partnering with others, developing a governance approach, and really looking hard at what we're actually doing and what the value it's providing.
Yeah.
So I'm kind of taking it down to the technology to the higher level, right? So this is why we get together at these conferences.
Well, I would say the stakes, it's not just generative AI, but on a lot of different levels, like for instance, in relation to HIPAA, and the 2022 guidance around, in December of 2022, the guidance around behavioral tracking and HIPAA, and many other issues that are emergent issues. We have a lot of issues in consumer healthcare that are relatively high risk issues, and where the windows of time to get somewhere or to figure something out aren't infinite. You know, it's not the slow moving. It's not your grandfather's old slow moving,
Yeah.
world. I mean, it's like we have to address this quickly, or we're going to either be left behind or create risk. And so I think what you're talking about is, and I think this is really spot on, is that there has to be a lot more clarity around substance-driven goals, and that really do cross the kind of institutional structure, and there has to be a ton of collaboration to work things out. And I think the good news is a lot of people are rising to that, necessarily rising to that call. But it's tough when there's a lot of education that people need, and I think for consultants who work in this world, there's a premium on being able to really give good advice, because a lot of these things are non-trivial, like the outcomes. It's not just do you get 5% more or less, patients for bariatric surgery. It's really like, do you have HIPAA violations? Do you give totally wrong advice, over a chat bot, etc. So, yeah.
So that's why these are some of the hot topics we're talking about now.
100%.
I'm gonna ask you now to look into this little tiny crystal ball that we have right here.
Yeah, I'm excited. I'm excited.
Because last year at this conference, this is not what we were talking about.
Yeah.
And now, looking forward into the next year, feel free to steer in if you'd like to, but what would your prediction be? What are going to be the hot topics in a year from now?
Well, I think one of the things that I really strongly believe is going to be very different a year from now from today is I think a lot of the things that people at this conference think are going to be the associated practices, tasks, or activities associated with operationalizing these technologies are going to turn out to be not those things. Like there's going to be a whole nother set of things. And that is because the depth of the problems probably haven't been fully understood, but the problems that we understand well today, some of them are actually going to be taken care of by the technology itself.
Yeah.
So there is sort of a weird self-erasing thing around these AI technologies where, because they essentially tokenize and commodify understanding, once problems are well understood, they can kind of incorporate them. Yeah. So I think everybody who's trying to figure out what the next best thing to do is struggling to some extent with this issue that the whole field is likely to kind of eat itself a little bit, so to speak. That's one thing. I think the second thing is that the technology platform space that people are used to using has to become tremendously more flexible to interact with all this change that's happening because of AI. And also, it has to be, there have to be many more choices within it because of things like AI regulation that's going to come and HIPAA issues and those kinds of concerns. And so that's going to really drive composability, which is the idea that you don't buy some monolithic Swiss Army knife that does everything, but that you build things together out of best of breed components, and you have the choice to get rid of them when they run afoul of these issues or whatever. And that's a whole new thing, and it does speak a lot to the IT marketing collaboration.
Yeah.
It also speaks to building up technical competencies directly within the marketing department that are more focused maybe on technologies that are, let's say, more transient. Like you're not buying into something for 6 years or 10 years. You're doing this for 2 years and seeing how it works, and then possibly doing something different.
Wow.
Yeah.
Wow,
and we're not talking about giant multi-million-dollar builds either. We're talking about much smaller chunks of activity. It also only works if there's a lot of accountability.
Yeah.
And I think that has been sometimes missing from the equation. So, yeah.
Well, this has been great. I just love talking to you, John.
Totally my pleasure, Chris.
I'm so
Likewise.
Glad that you're here. Yeah. So thanks for
absolutely. And this crystal ball here, is this actually powered by AI? Because it was showing me some really weird things, and I think it might have been hallucinating. All right. I'll see you later.